Are you tired of all the pessimism about healthcare in Africa? So am I. So let's talk about it. I set out to launch a heavily research based podcast. And as I was preparing, I found myself listing all of the negative stats about healthcare in Africa. And let's face it, if you've lived in Africa, if you have family or friends that have lived in Africa, if you work in global health or in any remote proximity to Africa, you already know these things. You know that we don't have enough doctors. You know we don't have enough nurses. You know we don't have enough hospital beds, enough clinics, enough drugs. We all know these stats. And so I really had to remind myself of the why behind this podcast. And one of the big whys for me is to infuse hope back into the narrative about African healthcare. And so I really had to shift gears. So I'm not going to list out the facts that you probably already know. I'm going to focus on what is important, what is in front of us, what are the opportunities, what are people already doing, what are the things that are new and innovative that will really inspire hope, that would show us that there is potential and that there are untapped opportunities on the continent. And that is what The Cure is. That's what The Cure is going to be. That's what every episode is going to focus on. We're going to have a future-focused, hope-filled conversation. Now, don't get me wrong. We are going to acknowledge the realities. We are not going to sugarcoat it, but we are not going to force negative statistics down your throat. We're going to really focus on what we can do next. So if this sounds like something that interests you, I implore you to keep listening. Now, here's the part where I tell you all about myself and attempt to answer the question of why you should listen to me. So here goes. My name is Temitope Coker. I've spent my entire career advising in the pharmaceutical, life science, biotech, and global health industries. My work has been shaped by training across global institutions like Columbia University, the WHO, and UN. And I have a passion for increasing access to life-saving medicines for patients across the globe, but particularly in Africa. I started TC Health to bring research-driven insights into the pharmaceutical and healthcare landscape in sub-Saharan Africa. And this was to really move the conversation forward. And to date, we've published thought pieces on topics ranging from the pharmaceutical landscape, mental health, cancer care, pharmaceutical manufacturing, and the list goes on. The Cure is the next step to that. It is a place for deep and honest dialogue about what the future holds for healthcare in Africa. So let's get specific. What is The Cure? The Cure is a deep dive podcast covering all things healthcare in Africa, from technology and investments to policy, research, and infrastructure. Each episode features industry leaders, investors, policymakers, and innovators driving change in the sector. You may be asking, why now? Africa's healthcare sector is at a pivotal moment. We are sitting at an inflection point. And I don't know about you, but the African healthcare space feels different to me right now. There is a new energy in the air. There is a once in a lifetime chance to completely change the narrative, to flip the script. We've seen massive shifts in African healthcare in either direction. Most notably, we've seen donor funding cuts to foreign aid. But we've also seen demographic shifts. We've seen what AI can do in terms of leapfrogging entire industries by decades. We've seen local manufacturing commitments, and we've seen new funding models emerging, all pointing to a hope in African healthcare that feels tangible, real, and just within reach. So African countries, African governments, African entrepreneurs, African clinicians, and African people have a choice to make. And that choice will determine what kind of future the African healthcare landscape faces. It will determine how many people receive medicines that could save their lives when they need them, how many people are able to afford these medicines, how many mothers and babies survive childbirth, how many hospitals and clinics are operational and able to serve the masses, how empowered our doctors, our nurses, our scientists are to keep saving lives. So again, I reiterate, we are at an important inflection point marked by huge challenges, but incredible potential. What we do next matters. And this moment requires future-focused thinking and courageous storytelling. This show exists to curate both. So here's our thesis. The next decade belongs to people who can design and scale practical business models for African health. Not copy and paste, but context first. Blended finance where it helps. Local manufacturing where it's efficient. Regulation that protects patients and enables innovation. Pricing that matches real ability to pay. R&D strategies that include African genomes and lived realities. We look for what is already working and what can scale, and then we amplify those stories. At the heart of every conversation is one question. What does it take to revolutionize the African business model? We ask it every time. Our guests answer for their slice of the system. We pressure test it, we dive into it, and then we translate it into a bigger picture that you can get behind. The Cure is a context-rich, insight-driven show. Our episodes will feature long-form interviews. Through rigorous, research-driven discussions, we go beyond just surface-level insights to deliver depth-first content tailored for a serious, forward-thinking audience that cares about the future of healthcare in Africa. I like to think of our audience as healthcare enthusiasts. This show is for clinicians, pharmacists, researchers. It is for policymakers and regulators who are shaping the rules. It is for investors and founders building in or near health. But we don't just stop in the healthcare space. The show is also for the curious professional who is passionate about emerging markets, economic development, and Africa's growing story. It is for future innovators, individuals that are seeking inspiration, insights, and real-world lessons on building impactful businesses in Africa. Whoever you are, my hope is that The Cure sparks new ideas and infuses hope in your view of Africa. The theme of our first season is By Africa, for Africa. We sit with leaders building African genomics and precision medicine. We speak with data and capital experts who can show where the money is moving and where signals are being missed in healthcare. We meet executives in pharmaceutical manufacturing who are localizing production with a patient-first lens. We unpack what domestic capital looks like and what is funding care delivery and infrastructure. And we revisit health tech in Nigeria with founders who are rebuilding the playbook around unit economics, trust, and distribution. In essence, we explore how African voices, innovations, and investments are driving the future of healthcare on the continent. We spotlight healthcare models built by Africa, for Africa. As you can see, the guest seat is empty today, but I want you to imagine yourself in that seat. I want the conversations to feel like you're part of it and that you have a seat at this table, inspired to make change in the African healthcare landscape. Whether you're a seasoned healthcare professional or an entrepreneur that's just starting out, I want you to ask yourself the question, what does revolutionizing the healthcare business model look like for you? And then I want you to be inspired to act on it. Okay, I'm almost done talking. By now, I should have answered a few questions. What is the cure? Why now? Why me? And what's next? I am an optimist. And whether you're a healthcare enthusiast or Africa enthusiast, I invite you to be optimistic with me as we explore what the future of healthcare in Africa looks like. So, subscribe to The Cure wherever you get your podcasts. Follow us at The Cure Pod Africa on all social media platforms. And we are tied to TC Health. A lot of our insights are powered by TC Health. So send your ideas, send your guest nominations to tchealthng@gmail.com and follow TC Health for the latest and greatest research that we publish. And finally, share this with someone who is tired of problem-focused narratives in Africa and could use a bit of hope right now. Thank you for listening to the pilot of The Cure. I'm Temitope Coker. See you in episode 1.